Hi, I'm Dr. Derek Schaller. I'm an emergency medicine physician working for CMU Health in Saginaw, Michigan. I'm the Assistant Program Director of Emergency Medicine for the residency program in Saginaw, Michigan, as well as Clerkship Director for the Emergency Medicine Clerkships for the CMU College of Medicine. I've been asked recently about signs and symptoms of COVID-19. Some of the symptoms that you're most familiar with that might suggest you've been infected include cough, fever, shortness of breath at home. Some of the symptoms that you should be aware of include things like headache, sore throat, body aches including chills, shaking, and muscle aches all over. You might have a sore throat or a headache. We've even seen people with loss of the sensation of taste or the sensation of smell. We've also occasionally seen people coming in with some GI illness, including nausea, some vomiting, and even occasionally some diarrhea. We've been asked who's at highest risk for being infected and for having a severe outcome with COVID-19. There are two things you should know. One, people who are immune compromised and have anything that would depress their immune system. This can include underlying diseases like AIDS, HIV, or even things like smoking that can stymie your body's natural immune defenses. Anybody on immune modulating medications, including long use or chronic use of steroids, puts you at an immune compromised state and makes it easier for you to contract this virus. Advanced age may also wear on your immune system and can make it easier for you to become infected. Those who have a higher risk of having a bad outcome include those with advanced age over the age of 65. Also, people who are demonstrating significant comorbidities, which means additional medical problems. People with high blood pressure, heart disease, lung disease like asthma or COPD, or underlying diabetes, or any other chronically uncontrolled medical problems are at the highest risk for bad outcomes. There may be a racial disparity as well, and we may have worse outcomes in those from African American and Hispanic American populations, but further research is required to really understand this in full detail. One of the questions I receive most frequently is, when should I seek treatment for COVID-19? COVID-19 causes respiratory symptoms, among others. The most important time you should seek treatment for COVID-19 is if you're having significant trouble breathing. If you're having simple cough at home, that does not necessarily require emergent treatment. However, if you're having shortness of breath even at rest, or becoming winded or short of breath just by walking around your house, these are indications that you may be having a significant problem and need to seek treatment. You should keep an eye on your heart rate as well. If your heart rate is significantly elevated at home, that could indicate that your body's having a hard time getting oxygen and you should seek treatment. If you have further questions about this or still aren't certain, contact your primary care provider or one of your local telehealth resources for a screening evaluation for further guidance. Right now, a lot of people may be wondering when they should be tested for COVID-19 and how to go about doing so. You can contact your primary care provider or local health department to direct you to a testing facility or drive-up testing site to help you be tested. Right now, in the state of Michigan, anybody with symptoms can be tested. We've expanded testing capabilities to that point, and this is an excellent thing for all of us. However, don't forget, if you're having significant symptoms and you think you're very short of breath or are concerned about your health, you can present to an emergency department to be seen for medical treatment as well and be tested at that time.